We'll quickly look at the guide, a guide to evaluating the chest X-rays in heart disease. Okay, so let me say this is like for beginners who are trying to like study the chest X-rays, see what the chest X-ray is, and how to interpret the chest X-rays and images that will be given to you. All right. So if you suspect that a patient actually has what heart disease, what are the approaches, okay, to interpreting the chest X-ray? Like you say, a patient to go, they should go do some tests. Right, go to the laboratory, do some tests. So when they bring this, what are the approaches towards what evaluating or interpreting chest X-rays if you suspect there's heart disease? So I would like you guys to note something. I don't think it is in the picture, all right, but I would like to just tell you guys something which is outside the concept. Now, can you see this is a thoracic ratio? Thoracic ratio is what? From one side of the thoracic cavity to the other, right? Then a cardiac ratio is basically what? You're trying to look at the highest what? Diameter of the heart. Okay? So in normal, the diameter of the heart divided by the intrathoracic diameter should be lesser than 0.5. Okay, so if you find it more than 0.5, that shows that there's what? An enlargement of the heart. Okay, so that's what? A cardiothoracic ratio. So the cardiothoracic ratio normally should be what? Less than 0.5. If it is more than 0.5, there's what? A cardiomegaly. All right, so that's one approach. Now the first step to identify, the first step, like once you get an x-ray, the first thing you should do is what? Identify the film. Okay, you identify and make sure that it is a chest x-ray. Okay, then also identify the patient that it belongs to. All right, so you can actually take the chest x-ray. There could be a mix-up in the lab, and if you don't identify the patient, it could be that you are interpreting a wrong result for another individual. All right, so you identify and you verify that okay, it actually belongs to this patient. Next, know the type of x-ray that it is. Okay, is it a posterior anterior x-ray or is it a lateral view x-ray? Okay, now the overall size of the cardiac silhouette, its position, and the position of the ascending aorta must be specifically what? Evaluated. Okay, then dextrocardia. This is actually a rare condition where the heart is located to the right side of the chest. It is actually easy to identify. Okay, so it's just what? Precautions. So you should always make sure that uh, the position of the heart is on the left. Okay, it's rare to find it on the right, but just always make sure, all right, just to be on the safe side. So we've spoken about three things. First one is to check out for what? The cardiothoracic ratio. Next one, identify what? That it is a chest x-ray. Next, identify the patient. That's three things, right? Next, identify which view. Next, you should check out for the size of the heart and all that. Then next, check out for dextrocardia. That's six things, right? The lecture will look scanty, but there's a whole lot of facts in it. Next, the lung fields are evaluated carefully for masses and infiltrates. So you want to identify the lung fields. You want to check out for the pulmonary vasculature. You want to check out for the heart chambers. You want to check out for the great vessels of the heart and all that. Okay, just to what? Rule out that there's masses or there's swelling up and all that. Now, other areas are easily okay. Other areas that are easily ignored, such as the thoracic spine, the neck, the costophrenic angles, the lung apices, should be carefully what? Evaluated. Okay, so this is a guide to evaluating what? Chest x-rays in heart disease, like if you actually suspect that somebody has a heart disease. Okay,